Bismillahirrahmanirrahim. We will start with quote of the day. He is the one who provides me with food and drink. I am Dr. Taimia Ayub, and I will be presenting today the topic of balanced diet and related concept to the balanced diet under the kind supervision of Professor Dr. Saira Afzal at Institute of Public Health, Lahore. So, this is the outline of today's lecture. We will start with the concept and the public health importance of a balanced diet. What are the main components? And then different food based dietary models and guideline like WHO, from WHO, food pyramid, my plate, major dietary patterns and therapeutic diets, energy balance, dietary diversity, and food groups. And then concept of ultra processed food, nutrition transition, and NCDs, food security, sustainable diet, and One Health perspective. And at the end, we will do related multiple choice questions. So, these are the learning objectives of today's lecture. So, we will start with the concept of the balanced diet. A balanced diet is one that provides adequate energy, optimal amounts of macronutrients like carbohydrates, protein, and fats, and sufficient micronutrients, vitamins, and minerals, dietary fiber, along with water. From public health perspective, it prevents undernutrition and overnutrition, reduces risk of non-communicable diseases, and supports growth, productivity, and healthy aging. So these are the components of a balanced diet. Carbohydrate is the primary energy source, about 45 to 65% of total energy. Proteins for growth, repair, and immunity, about 10 to 15%. Fats for energy, fat soluble vitamins, 20 to 30%. Vitamins and minerals for metabolic regulation. Fiber for gut health, glycemic control, and water for thermoregulation and metabolic processes. Then we have macronutrients, which are carbohydrates like whole grains, fruits, vegetables. They should be preferred complex type of macronutrients over carbohydrates over refined carbohydrates. Then we have proteins like animal meat, eggs, dairy, and plant sources, legumes, and pulses, and they are essential for muscles and immune functions. And finally, we have fats to emphasize unsaturated fats and limited saturated and trans fats in our diet. Micronutrients. Key micronutrients are iron to prevent anemia, iodine for cognitive development, vitamin A for vision and immunity, vitamin D for bone health, zinc for growth and immunity. And hidden hunger remains prevalent in lower middle income countries. So, hidden hunger means that even though the person may be eating enough food or they may be getting the required amount of calories, but the micronutrients are not present in the desired amount, and as a result their body is still hungry for those micronutrients. Okay, so nutritional requirements across the life course may usually change when a person, in cases of infants and children, growth is required for increase in size, and then brain development. So these are the key requirements. Then for adolescent, increased energy and micronutrient needs are more. In adults, maintenance and productivity. For pregnant and lactating women, increased protein, iron, folate, and calcium. And in elderly, lower energy level, higher nutrient density is required. Now we come to the concept of food pyramid. The key principles are at the base of the food pyramid, we have cereals and whole grains, and in the middle, we have fruits, vegetables, proteins, and foods. At the top, we have fat, sugar uh, to be taken very in this minimum quantity. And the strength of this is that it is a simple population level guidance and it is easier for everybody to understand. And it limitations are that. It is less culturally adaptable. It means that every person's, every area, or every country has their own cultural perspective, and the food pyramid, which is a concept, may not be applicable to them as it is. So, this is a diagram of a recommended food pyramid Then we have water, mainly to drink water and add fibers. Then starting from the bottom, we have carbohydrates, and then fruits and vegetables, dairy product, 3 servings a day, meat, poultry, fish, eggs, beans, and nuts, 2 serving a day, fat, spreads, and oil in very small amount, and foods and drinks high in fat, sugar, salt should not be taken every day. So this is the concept of a food pyramid. Now we have another concept which is called my plate model. In this, a plate is divided into half for fruits and vegetable, fourth for grains, preferably whole grains, one-fourth for protein, and then we have dairy on the side like milk or yogurt. So it is easier visual tool for behavioral change and communication. A person can look at this and remember it easily and apply it in their own diet. So, as mentioned, vegetables and fruit take up half the part of that plate. The more vegetables, the greater variety, and it's good for the health. And then we have plenty of foods, and then we have whole grains, like whole wheat bread, whole grain pasta, and brown rice, and limit refined grains like white rice and white bread. And then we have healthy proteins like fish, poultry, beans, and nuts. Limit red meat and cheese. Avoid bacon, cold cuts, and other processed meat. And on the side, we have water and other dairy products. And then we have WHO healthy diet guidelines. According to World Health Organization, a healthy diet should include greater than or equal to 400 grams of fruits and vegetables per day. Limit free sugars to less than 10% of the energy. Limit salt intake to less than 5 grams per day. Replace saturated fats with unsaturated fats and avoid industrial trans fats. Now we come to DASH diet, which is the dietary approaches to stop hypertension. So this is a visual representation of the DASH diet, starting from the top. 4 to 5 servings per week of nuts, seeds, and legumes. Less than 6 servings per day of lean meat, poultry, or fish. Less than 5 servings per week of sweets. 2 to 3 servings per day of fats and oils. 2 to 3 servings per day of fat-free or low-fat dairy. 4 to 5 servings per day of fruits, 4 to 5 servings per day of vegetables, and 6 to 8 servings per day of whole grains. At its core, DASH diet is high in fruits, vegetable, and whole grains, low fat dairy, and reduced sodium, red meat, and sugars. It is effective for hypertension and cardiovascular disease prevention. Now there is another type of diet which is very popular these days, which is the Mediterranean diet. Uh, it uses olive oil as primary fat because it is from the Mediterranean region, where olive oil is a basic component and an important part of their fruit daily diet. It has high intake of fruits, vegetable, legumes, and nuts, moderate fish and poultry, and limited red meat. It is strong association with reduced cardiovascular and metabolic diseases. So this is the main picture to show that olive oil is the main ingredient. Along with we have olive, tomatoes, salads, and like that. And similarly, Mediterranean diet has its own pyramid in which the base is always of vegetables, fruits, whole grains, legumes, beans, nuts, seeds, olive oil, herbs, and spices. Then we have fish, seafood, mainly as a source of protein, and then poultry, eggs, and cheese comes, and at the very less we have meats and sweets. Then we have low carbohydrate diet. Uh, by definition, it is reduced carbohydrate intake, less than 40% of the total energy, higher proportion of proteins and fat, and it is important for type 2 diabetes management and obesity and metabolic syndrome. The concern is that long term cardiovascular safety, it promotes that, and micronutrient deficiency if poorly planned. So this is a balanced plate for low carbohydrate. uh, uh, as you can see on the right side, again there are fruits and vegetables, non-starchy vegetables, the emphasis on that. And then we have one fourth of the plate for carbohydrates, and again and protein are in one fourth of the plate. And for the carbohydrates, these are the complex carbohydrates like potato, sweet potato, quinoa, whole wheat pasta, brown rice, whole grain, or sourdough bread. And for non-starchy vegetables, we have spinach, courgette, tomatoes, aubergine, broccoli, mushrooms, carrot, peppers, and so on. Then there is another important concept and the diet which is being quite famous these days, which is the ketogenic diet. So it is very low carbohydrate, even less than 10%, and high fat intake. It induces nutritional ketosis. It it was main use for drug resistant epilepsy and short term weight loss. The main limitations are that it is not suitable for population wide implementation and it requires medical supervision. So this is the calorie distribution on a ketogenic diet. You can see that 75% of the calories are from fats, 20% from the protein, and 5% from the carbohydrate in this example. Then we have vegetarian and plant-based diet. They have different types like lacto-ovo vegetarian, vegan, and flexitarian. They are important from public health perspective, like they have benefits of lower risk of cardiovascular disease, reduced obesity prevalence, environmental sustainability. Key nutrients which should be monitored are vitamin B12, iron, calcium, and omega-3 fatty acids in these population, because there is a chance of decrease of these nutrients in their diet. Again, as you can see, half plate is from non-starchy vegetable, one fourth is from fiber-rich carbs, and then we have one fourth plate of protein, uh, and we have cheese in that, and legumes and stuff like that. So why eat plant-based food? They boost immune system, reduce inflammation, maintain a healthy weight, increase fiber, and lower cancer risk. Then we have high fiber diet. The main sources in this diet are whole grains, fruits and vegetables, and legumes. Benefits include prevention of constipation, reduces colorectal cancer risk, improve glycemic control, and lower cholesterol. And the main importance from public health point of view is that NCD diet related non communicable diseases are prevented. So the food which are rich in fibers include whole grains, legumes and beans, nuts and seeds, fiber supplements, vegetable and fruit again. These are some of the therapeutic diet which are used for different disease or conditions. Like we have diabetic diet for type 1 and type 2 diabetes, renal diet for chronic kidney disease, gluten-free diet for celiac disease, low-fat diet for gallbladder disease, and high-protein diet for severe malnutrition. So according to the different conditions or diseases, same concepts can be applied, and some food items can be increased and some can be removed from the diet to make them relevant for that particular person. Now we come to the concept of energy balance. So we have an equation of energy balance, which means that energy intake is equal to energy expenditure. And if there is imbalance, it leads to positive balance. Then a person will be overweight and obese. And if there is negative balance, a person will be underweight and wasted. For public health link, it is the important. This concept is important for obesity epidemic and double burden of malnutrition, which is happening right now in many countries. So we have on the right side a figure depicting this concept. We have energy intake and energy expenditure. Energy intake depends upon behavior, food availability, and satiety, and energy expenditure depends upon physical activity, sedentarism, and genetics. Then we have the concept of dietary diversity. Consumption of a variety of foods over a reference period. It is important as a proxy indicator for micronutrient adequacy. It is used in maternal and child health programs. And minimum dietary diversity, MDD, is a common indicator for this. Then we have the concept of food groups. We have major food groups like cereal and grains, fruits and vegetable, protein foods, dairy, and fats and sugar. So these are the mainly used for food-based dietary guidelines and nutrition education. So on the right side, the figure is showing different food groups. Like we have protein group in which there is meat, fish, eggs, tofu, and then we have dairy group with milk, dairy products, cheese, and then we have carbohydrate and cereals and grain group. Then we have fats with fatty food, oils, butters, etc. Fruits and vegetable, sweets, and finally we have drinks with water, tea, herbal tea, coffees, etc. Now we come to ultra processed food. These are the foods which are high sugar, salt, and unhealthy fats. They have low nutrient density as compared. So the important impact on health is that they increase obesity and leads to more cardiovascular diseases and diabetes also. And what should be done at population level is that we should make more rules and policies regarding food labeling, and taxation should be done, for example, on sugar-based sweetened beverages. On the right side, there is a comparison on dividing food into four categories. First, we have unprocessed or minimally processed food. Then we have processed ingredient, and then we have more processed food, and then finally we have ultra processed food. In unprocessed or minimally processed, we have fruits, vegetable, eggs, milk, meat. For processed ingredient, we have olive oil, sugar, salt, honey, butter. Then for processed, we have ham, cheese, bread, bacon, salted nuts. And ultra processed, we have ready-made meals, breakfast cereals, and these are the ones which have the highest quantity of ultra processed. Then we have concept of food security and nutrition. So food security has four pillars: availability, access, utilization, and stability. And it is a direct determinant of nutritional status, and it is linked with poverty and social protection. On the right side, you can see the four pillars, and on the top, there is the triangle of food security. This is the food insecurity level. So, in the green part, we have food security, which is adequate access to food in both quality and quantity. 5.7 billion people globally are food secure. Then we have moderate to severe food insecurity, uncertainty about the ability to obtain sufficient, safe, and nutritious food. 2 billion people globally face moderate to severe levels of food insecurity. Then we have severe food insecurity, which is inadequate access to food, with some people going days without food. 750 million people globally are severely food insecure. Then we have concept of nutrition transition, which is basically shifting from traditional diets to energy dense processed food. The consequences are the rising burden of non communicable diseases and coexistence of undernutrition and obesity. This is from an article which was published, and the title was The Socio Ecological Context of Nutrition Transition in Indonesia, a qualitative investigation of perspective from multidisciplinary stakeholder. So, in this, they studied the concept of nutrition transition, and they see that which um, perspective led to this and which concepts were part of the nutrition transition. So, first of all, we had environmental and policy uh, regarding food. Then we have community, religion, culture, and taboo beliefs, cooking practices. Then we have interpersonal points like family meal patterns, home cooking versus eating out. And then we have intrapersonal factors like awareness about adherence to healthy diets and food preferences by. This all leads to dietary behaviors, and this ultimately results in cardiovascular disease risk factor among other diseases. Now we have concept of one health and sustainable diets. The main concept is human health, animal health, and environment are interconnected. This is the main concept of one health. And sustainable diets are those which are nutritious, low environmental impact, and they are culturally acceptable. So, this is joining the concept of One Health with an important concept in food and nutrition of sustainable diet. So, as you can see, sustainable nutrition is when the food is in bulk, seasonal, local, and organic food, learning about sustainable food and sustainably sourced supplements. So these are the basic concepts which were part of the today's lecture. Now we will go to the multiple choice question of today's lecture. So a district health officer plans a nutrition program to reduce both anemia and childhood stunting. Which dietary strategy best addresses his goal at population level? Increasing total calorie intake only, promoting refined carbohydrate consumption, improving dietary diversity across food groups, reducing fat intake below 10% of the energy, or encouraging ketogenic diets.
C.
C.
Yes.
C.
So, yes. So the concept of dietary diversity is very important in this example particularly. During a community survey, many adults consume adequate calories but show micronutrient deficiencies. This situation is best described as protein energy malnutrition, B. Overnutrition, C. Food insecurity due to availability, D. Hidden hunger, or E. Negative energy balance.
E.
It is yes, it is D.
C.
D. Hidden hunger of micronutrient deficiency, which is not apparent but it is present. So it is related to the concept of hidden hunger. A public health nutritionist recommends limiting free sugar intake to less than 10% of the total energy. This recommendation is primarily intended to prevent iron deficiency anemia, vitamin A deficiency, dental caries and obesity, osteoporosis, or iodine deficiency.
C.
C.
Yes, so dental caries and obesity is very important. A primary care clinic adopts the DASH diet for hypertensive patients. Which dietary modification is most critical to its effectiveness? Increase intake of saturated fats, high red meat consumption, reduce sodium intake, elimination of carbohydrates, high added sugar intake.
C.
Yes. So main concept
उस
is
शेल्फ में C.
G. Main concept is based on reduced intake of sodium. A pregnant woman consumes adequate calories but low iron and folate. From a public health perspective, the most appropriate intervention is to reduce total energy intake, focus on micronutrient dense food, recommend a low carbohydrate diet, eliminate dietary fats, or promote ultra processed food.
B.
B.
Yes, it is B, micronutrient dense food. A nutrition program uses minimum dietary diversity as an indicator. This indicator is most useful as proxy for total calorie intake, protein adequacy, micronutrient adequacy, fat quality, or water intake.
C.
Yes, micronutrient adequacy, it is an important indicator. A clinician advises a ketogenic diet for a child with drug resistant epilepsy. From a public health standpoint, the main limitation of this diet is that it is ineffective for weight loss, it is unsuitable for population wide use, has high carbohydrate content, lacks clinical evidence, or increases dietary diversity.
D.
B.
Yes,
B.
it is B. It is unsuitable for population-wide use. A community shows increased consumption of fast foods and sugary drinks with declining intake of traditional foods. This pattern illustrates food security, nutrition transition, dietary adequacy, sustainable diets, or balanced energy intake.
B. B.
Yes, it is nutrition transition. Promotion of plant-based diets at population level is more strongly supported because of their association with high saturated fat intake, increased micronutrient deficiencies, reduced cardiovascular disease risk, high salt consumption, or increased obesity prevalence.
C,
Yes, it is reduced cardiovascular. A household has stable food availability but poor child nutrition due to improper feeding practice. Which pillar of Which pillar of food security is primarily compromised here? Availability, access, utilization, stability, or sustainability?
C,
C,
Yes, it is
B.
utilization. Utilization is the answer. So this is the MCQ key. This is the YouTube link where this presentation will be uploaded. And thank you very much for listening.